eradicated, then it is assumed that process continues, and then, of course, it will go to the end stage.
Okay. Now, you spoke about how less activity and more rest will help somebody's joints and all that. But people have said that exercise is good for the joints. So yes. Where is the meeting point?
No, I think what I meant was that if you have an arthritic condition, the aim of treatment will be, one, to increase movement and activity of that joint.
Okay.
Also, you need to reduce the load on that joint. You need to eradicate pain, and then you need to increase the function of the joint. Now, where you have arthritis that is acute in nature, that has presented with some inflammatory process going on with it, then the tendency is for you to want to rest the joint at that point to at least. Then after you remove the pain, of course, if you have pain, you want to keep the joint.
Definitely, you
so
don't want
once
to
the pain
exercise
is
that
eradicated,
joint.
then you need to encourage movement.
Okay, so in encouraging movement, are there some types of movement that are encouraged and some that are discouraged?
I won't be able to give you the details because it depends on the joint you're dealing with.
Okay.
However, the physiotherapists are in a position to give you types of exercises that you need to do. It's not only exercise used in treating osteoarthritis.
Okay, before we go to that,
yes.
we need to take a short break. When we come back, we'll continue with that.
Right.
Please stay with us. We're talking about osteoarthritis. We'll be back in a minute. Welcome back to Health Matters. We're talking about osteoarthritis, and you can call in now for questions, your questions to be answered on the topic. The number to call is 0808 054 2233. That's 0808 054 2233. And you can always tweet at CTV_Mary A. And your tweets may be read on the show. Doctor, we were talking about exercise as a means of prevention, right?
Exercise yes, you can prevent, because when you exercise, you lose weight, you're not obese.
Okay.
So exercise would help improve the movement of a joint. But exercises are not the only modality of treating osteoarthritis. You have other methods, including physical methods.
But before we go to the treatment, my aim in all this is there a way somebody can avoid having osteoarthritis throughout his lifetime?
No, it's if you grow old enough, you have your joints degenerate.
Eventually.
So you
nothing like injecting some synovial fluid or cartilage?
No, it's just the only thing I can tell you is that I'm not saying when you have, everybody will have arthritic change in their joints when you grow old enough, but not every joint is symptomatic. So you may have a degenerative process going on there.
With no pain?
Yes, so you may have a situation. Some people, you find them very slim and all that. You don't expect that, but doesn't mean the degenerative changes are not taking place in that joint. But somebody who is obese, who is growing, who is elderly, you expect that that person who is at risk will have maybe more symptoms.
We are getting a call right now. Let's see if we can get this call. Hello. Hello? Apparently there's nobody there right now, but keep trying. So we were talking about...
So we're saying that x-rays are very important, and sometimes you do x-rays, and when you do your x-ray, you find that the typical findings on the x-ray, find that the joint has reduced, the bones in trying to regenerate itself, you find some bones formed at the periphery of the joint itself called
new bones.
Yes. But it's not. It doesn't form a mature bone. It's just that it's at the periphery. It's an attempt at repair.
Okay.
And then you have a situation where you also have the soft tissues around the joint itself that helps to maintain stability. Becomes fibrotic. That is, becomes caked up. And so when the joints at the load, as the progress gets worse, find you may have a situation where you have deformity. which might come in the form of in the knee, bow leg, K legs, or you might have situations where there's this sort of extension and flexion you find in the joint. You may have a situation where the joint is fixed in one position.
So how do you treat?
Like I said, treatment includes physical modalities, medications, and surgical. Now, depending on the stage of the disease itself. So for mild osteoarthritic stage, you do those things I said, reduce load on the by doing physiotherapy. Lose weight, and then you encourage movement in terms of little exercises for the joint. Sometimes we use ice, yes, or heat, ultrasound and all that. Then medication, use of non-steroidal anti-inflammatory drugs. So these are supposed to be used judiciously because
they have to be regulated, right? Because something else could result
happen,
from that.
Ulceration of the stomach and all that. And then for the mild, where you have deformities, you may now decide to do what you call osteotomy. And what you're doing is trying to redirect the joint itself so that the areas that are eroded are taken away from the load.
Okay.
So you redirect the bone. And in the last stage in which you have so much loss in the cartilage and there's so much pain,